Thank you for listening to American Medicine Today this Saturday afternoon. I'm Kimberly Brumell, joined by world-renowned orthopedic surgeon Dr. Alfred Bonati of the Bonati Spine Institute and our executive producer, Ethan Euchre.
Glad to be here as always, for sure. We're going to check in. We actually, last segment, we're talking to Dr. Stibich about his TMS therapy to cure depression. It uses magnets and things like that. It's very, very fascinating. And Dr. Bonati asked that he stick around for
one more segment.
This segment.
Let's look at what's new in medicine today, featuring Alfred Bonati, MD.
All you, Dr. Bonati.
Jason, I am very, very, very impressed with this. It's something that is shocking to see that this is a situation that we need to address. And I'm trying to bring you back to insist on this because the amount of population can benefit from this service is enormous. It's around 19 million of Americans that they are suffering of a major depression. And as you said in your explanation, this breakthrough is 2/3 of such patients responded to TMS, and half achieved a major remission. Would you expand a little bit on this one, because I think we have the horse reverse. We have the horse on the back and the carriage in the front, and I think we need to put the direction here. If you treat the patients first with this procedure, then you will cut all these medications, all these expenses, and all these people walking like zombies. Tell us a little bit more about this procedure. How you envision that this needs to be treated, and how you envision that this needs to be directed to the public.
Right, like the FDA says, after failure of one medicine, you can start TMS therapy on anybody as long as they're depressed. But really, people by the time they've come and seen me, they're already been on 1 or 2 or 3 or 4 medicines. So yeah, after that, the studies that they did, 37% remission. That means no more depression. After even these people have tried 4 drugs. If you've only been on 1 drug or no drugs, the success rate should be phenomenally better. And the patients that we've treated in our office, they've all gotten better. I haven't had like one failure, so it's a really remarkable treatment. It's treating depression in the 21st century, which everything else has been back years and years ago.
Yeah, one of the things that the application is incredible. You have really a very important subject here on females. The postpartum depression is horrendous, and it's not being treated because the mothers are very concerned about how they're going to feed the children with medication on their body, and then transport the medication to the milk and the milk to the baby. So they suffer this enormous amount of responsibility. At the same time, they go to the depression, and that depression is pretty bad.
Well, yeah, Dr. Bonati, we've seen people, we've seen some of these women, I think most recently was the woman, was it in Daytona Beach, that drove her van into the water with all the kids in it?
Yeah. But can you imagine if we put the horse in front of the carriage, and this treatment that is inexpensive, that extremely, if you're telling me that 2/3 of the people who had major depressions can be treated and being cured, there's no reason to wait for medications or any type of a intrusion in the body of the people before we try this procedure. This procedure is uninvasive. This procedure is totally healthy. This procedure takes very little time to do it and can be done in the office visit. So I encourage absolutely people who has this type of a problem to talk to you.
Right. The treatment's on average 4 to 6 weeks. We do it every day, Monday through Friday. It takes about 40 minutes of somebody's time. They feel better after the first week. Some people feel better after the first day. We can make sometimes their headaches go away. It's being studied in other realms of medicine. So we're talking about depression today, but eventually this might be something that the brain is something that's been it's been studied, but it's still unknown to science, and the same way with back pain and how that works and how that affects people. So
we touched upon it a little bit in the last segment about treating veterans with PTSD. Is that something you get into at all, or? Well, it's a big military town here, is why I asked. So I'm sure there's some soldiers listening that think, "Hey, if this can help me, then I want to go see Dr. Stibich."
Right. The government is probably one of the biggest supporters of the NeuroStar and their treatment. It's such a new and revolutionary breakthrough, but nobody knows about it. So, and the government has protocols to even put this kind of treatment into effect. So we're talking about it now, and in 5 years from now, you might actually hear somebody getting treated at the VA with this. So, yeah, they can come down to my office and get treated and be doing much better than they've ever done before in their life, and maybe they've suffered for 30 years, and we can fix that. So,
yeah, the problem, yes,
absolutely life-changing.
Just said it was life-changing.
Mm-hmm. Yeah, the problem with the government, I am an individual who hates government, and I hate politicians and I hate government. I really think those two are something that should be obsolete from the life of the country. But the important thing here is that if you look that this treatment at the VA is something that you're touching something specific when it can be broad, the treatment. Mm-hmm. You should treat this one for depression. You should treat for anything that's important that can treat the soldiers and give the soldiers a possibility of survival. Mm-hmm. If you have every day 22 vets are committing suicide, majority of the problem is depression. So if these people can be treated for something like that and can be placed in these monitors and have access to the service, I think that's what the government should do, instead to be acquiring the instrument, sitting the instrument on the back door and not releasing and treating the people properly. They are experimenting with one little part of the results of the war, when this one should be wide open, should go to depression and then to any other thing that it can do.
Yeah, correct.
All right. Well, we appreciate you stopping by once again, Dr. Stibich. And real quickly, if people do want to get in touch and they're interested in your TMS therapy, how do they do so?
We have a website, Brandon area TMS therapy, and they can call us 813-645-4068.
You are listening to American Medicine Today on News Radio 970 WFLA. We'll see you next week.
Thanks.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail. The Bonati Spine Institute is proud to announce more than a 94% patient-reported success rate in over 45,000 patent-protected spine surgical procedures. Call us today at 855-267-0483 or visit us at bonati.com.
All my pain is gone. Today I am totally pain-free. Nothing. No after effect.
I'm pain-free, and I have had to take any pain medication.
Today I am pain-free for the first time in over a year, and it is so awesome.
I only wish I'd known about it earlier. Right now, I am completely without pain.
Sitting here in this office right now, pain-free, eager to enjoy the rest of my life.
I am feeling great.
I feel 100% better, like a new person.
Today I feel absolutely fantastic. It's just incredible, the relief I feel right now.
Today I'm completely pain-free.
During the procedure, I literally felt the pain melt away. It was fantastic.
I feel so good.
It took care of my headaches instantly.
It's incredible. It's really incredible. It gave me my life back.
It's just wonderful. I feel fantastic.
It is just absolutely amazing.
So I'm hoping to be climbing hills in a few weeks.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.